isn't it? It's a tricky time.
So I know we're not due to start for another couple of minutes, so you're all in the right place, everyone who's on the line. It's great to see you. I've just popped the link in the chat box, so any students who are really keen to kind of get involved and are interested in support after today, then do make sure you just quickly fill out that registration form. It will honestly take you a few minutes, and I know the majority of you already are signed up to our program, but I've just popped that in the chat box now, so that will just take you a couple of minutes. So yeah, go ahead and do that, and we'll start in a few minutes. No, amazing timing, Freya. So we're just due to start in a few minutes. Everyone who's on the line, you are in the right place for the Pathway CTM NHS webinar. Thanks for joining us, and we'll just leave a few minutes because it is 5 p.m. on a Monday, so we'll give it a few minutes before we kick off, but thanks for joining us. Okay, I know that people will kind of be trickling on in the next few minutes, so that's absolutely fine, no problem at all. But it is 5 p.m. and we promised that we start at 5 p.m. So here we are. Firstly, and most importantly, I've seen a few questions in the chat box, which I'm going to answer, so don't worry, rest assured that I will do them quickly as we start. My name is Ellie, and I'm from Pathway CTM, and I'm hosting today's session, which is going to be really exciting. And I just want to double check if anyone else, can everyone else on the panel hear me okay? It looks like some people in the chat box are struggling. Okay, no worries, brilliant. So firstly and most importantly, yeah, welcome to the session. It's great to have you. So many people on the line today. It's absolutely brilliant. I'm so excited by that. We're always impressed by students that are choosing to spend, you know, their Monday evening post-school, in a very difficult time at the moment, being in a session like this to kind of learn a little bit more and find out some answers to questions, and also looking at the panelists and just seeing that I'm going to hand over to some specialists in a few minutes that are going to be talking about their experiences and things like that. But you're in such a great place to hear a little bit more about what opportunities are out there for young people and school leavers. So thank you for joining us. And really, we're going to hear from kind of quite a variety of different people today in terms of different roles. So hopefully you'll all get something from that. So I can see quite a few questions in the chat box, which will be answered in the next few slides, but really this one is quite important. And that is how you can communicate today. So I've seen quite a few people write in the chat box around, can I speak? Am I unmuted? For this session, you'll be able to communicate with us in the chat box like you are now. So please, can I see a few more hellos in there? And it's always good to see you kind of engaging with us and saying hello. So hi, Aisha. Brilliant, loads of hellos. Melissa, Clara, so good to see you. Thank you so much for joining us. I can also see quite a few people popping in there. They're kind of raising hands. And what I would say is do write your comments in the chat box, but do write any questions in the Q&A box, which you'll be able to see on Zoom at the moment. You are muted, so don't worry, you're not on camera. We can't hear you. There's no problem there. I've seen a few questions around that. But absolutely, we are here to kind of read your comments and get to your questions. So today is the perfect time to ask questions and get some answers on what it's actually like to work for the NHS and particularly in apprenticeship roles. So you're in the right place. And really importantly, happy National Apprenticeship Week. What a great way to kind of kick off with the amount of people we have on the line right now and some brilliant kind of speakers ready to talk about their experiences. So I've given you those kind of ways you can interact through the chat box. So I can see that's working. I can see a lot of hellos, and the Q&A box, I can already see 2 questions in there. So great. Everyone's got the hang of it and you're in the right place. In terms of raising your hand, I'll keep an eye on that, but really do try and communicate in the chat box and the Q&A box. We've got so much to talk about today, and we've got a kind of a forum to ask lots of questions. So do kind of hang around and make sure that you get those questions asked. Put them in the chat box at any time, the Q&A box, and I can keep an eye on them. And if you have any technical issues at all, then just do write a message to me, Pathway CTM, on the chat box throughout the session. And so what I'm going to do is initially I kind of put in the chat box a registration link. At the end of the session, I'm going to put in a survey link, and it's really important that you do kind of keep an eye on those and fill out those surveys for us, because what we really want to do is help you on your journey. So if you make sure, stay engaged, ask as many questions as possible, and do hang around and keep an eye out for that survey, and we'll make sure to follow up from today and make sure that you can get the most out of it and make your journey and next steps into the NHS. So great to see so many people communicating. That's brilliant. Like you've already seen, you can see me in person rather than just my emoji there. But my name is Ellie and I'm the Head of Employer Relations at Pathway CTM. So I'm really here to help facilitate today and make sure that you get the most out of the session. So do feel free to kind of pop any comments in there and we can really get going into the session. So that's who I am, and like I say, I'm going to be handing over in a second, and then we're going to be meeting some apprentices, which you can see on the screen, which is great throughout the session. But to kind of kick off there, before doing that, I'm going to hand over, but ahead of doing so, I just want to launch a really quick poll, so it will appear on your screen quickly now, and I just want to ask a few questions for you. So this should pop up for you now. So if you're able to quickly answer that anonymous poll, it'd be really good to see what your answers are to these questions. I'll just leave that for a couple of minutes. Great, I can see the answers coming in now. That's brilliant. Great, so I can see the number of people doing the poll is amazing. Up to 90 responses, that's great. I'm just going to leave it up there for a couple of seconds, and then I'm going to share those results with you, and it will really help us. It will really help us in terms of the next element of the session. So sharing these poll results, everyone should see them now. So I'm just going to quickly go through them before handing through to you, Claire, but do apprenticeships lead to a proper job? 97%, so over 100 people have said yes. That's very interesting. And 3% have said no. Are apprenticeships only for 16 to 18-year-olds? So 7% of yes said yes, and then 93% of no said no. That's really interesting. Thanks very much for filling out the poll. And then that third question is a degree apprenticeship a proper degree? So 90% have said yes and 10% have said no, so that's interesting. And can apprenticeships offer an alternative to university? 94% are saying yes and 6% are saying no. Very interesting. Can you become a nurse in the NHS through an apprenticeship? 90% again are saying yes, and that 10% saying no. And then our final question was, how many health related apprenticeships are there? Over 10, 30 or 70? So we've got 5% saying 10, 43% saying 30 and 51% saying 70. So that's really interesting. Thank you so much for doing that. And this is kind of how we mean to go on. So we want to communicate with you. Anything in the chat box, do kind of let us know. And Claire, I'm going to hand over to you to kind of introduce yourself and
Lovely. Thank you, Ellie. And yeah, thank you for this evening, and thank you so much for everyone to join us. My name is Claire Wardle, and I'm a programme manager at Health Education England, and they're like the training and education arm of the NHS. So this presentation will really be doing a little bit of myth busting, touching on the sheer range of apprenticeships available in the NHS. And it looks like a lot of you have got a good grasp already of the sort of maybe the typical opportunities. Also, we'll be covering how to access apprenticeship opportunities if you're particularly interested in gaining an apprenticeship in the NHS, and some of the things to consider when you are applying. And also some resources as well for any further reading. So we've got lots of good links for you to do a little bit of sort of research and investigations into finding the right apprenticeship for you, because I think that is really important at the end of the day. We're here to give you that information and that guidance, but hopefully you will feel that you're more aware of apprenticeships, the opportunities and where to go for that signposting by the end of the evening. So that's great, thank you. So next slide, please. So just to give you an idea of NHS apprenticeships, the year in figures. So NHS is obviously the largest employer in England with over 1.2 million employees, and it's expected to deliver a third of the public sector apprenticeships. And it's been a really busy time of all the trailblazer groups and employers getting together to create these new standards and apprenticeships to make them really fit for purpose for our future workforce. So we are expected to deliver 28,000 new apprenticeship starts as well. Thank you, Ellie. So there is obviously some misconceptions and myths about apprenticeships, as we've already indicated. Apprenticeships are only available for manual jobs, so traditionally maybe the engineering or maybe hairdressing, but you know that's absolutely not the case. And we will see throughout the presentation how we have more and more professional groups having apprenticeships attached to them, degree and master level apprenticeships, and particularly nursing, as we've mentioned earlier. Are apprenticeships aimed at people who didn't do well at school? Absolutely not. The apprenticeships are available for people sort of post GCSE level, but absolutely it's for people at all different stages of their careers. They may decide not to go to university and want to undertake an apprenticeship. And we're all aware of the sort of the loans students have to take at universities now. So students are actually making a conscious decision to choose an apprenticeship and earn while they learn. Cheap labour that doesn't lead to a proper job? Absolutely not. Our main aim is to provide a career pathway for apprentices to get to a profession that they want to do and to achieve, and it should automatically sort of gain sort of employment following their apprenticeship, because as an employer we've invested in our apprentices and we want them to stay within the organisation. They're not only available to school leavers. Obviously that is that option there that you can join from 16 if you are then supported on a full-term programme, but apprenticeships can be open to any age, any individual. We have people who've been in the NHS for a number of years and they're now doing accountancy or in HR or nursing, so it can be done at any age. And not a proper degree? Well, absolutely not. It is a proper degree. a lot of our degrees are delivered at the university, and they have one undergraduate group and an apprenticeship group. So it's absolutely the same quality assurance as any other degree. We do have a short film clip here from some of the NHS apprentices at Oxford University hospitals to hear what they said about some myth busting about apprenticeships in the NHS.
Apprentices do have employee rights. Every apprentice gets treated as the same as a member of staff. We receive a contract of employment, which includes workers' rights, for example, annual leave. Having these rights makes me feel part of the team.
Apprenticeships can and do lead to full-time employment. I'm doing a level 2 business administration apprenticeship in the maternity department. They give you the desirable qualifications for other employers. Over 90% of apprentices stay in full-time employment after they finish their apprenticeships.
I'm a nursing assistant apprentice on the upper GI ward at the Churchill. I really enjoy my apprenticeship because I can earn while I learn and I'm gaining experience in the workplace. Earning on the job and learning means that I can save up for driving lessons so I can access work more easily and gain independence.
Apprenticeships aren't only people who do badly at school. I did my A-levels and I got good results, and I still decided to do an apprenticeship because I thought it was a good career path that opened up different opportunities for me. Apprenticeships come at all different levels and there are people with all different capabilities, with different educational experiences.
Being an apprentice is both interesting and challenging.
One of the challenging parts of being an apprentice in microbiology is the Keystra urine processing machine, which gives loads of errors which I need to solve half the time. And every time I do, I learn something new.
And it's interesting because every day is different, so you're always coming across a new thing or a new skill to learn.
Apprenticeships work over all different sectors, not just manual industries. There are over 1,500 apprenticeships in different occupations. I'm a level 3 business administrator apprentice at the JR, and I work in the practice development team. When I was at school, I wasn't aware this apprenticeship was available for me, but I'm really glad that I found it because I really enjoy my job. Employers are now taking on more apprentices, and the opportunities are huge.
I started off doing my nurses training, which I had to withdraw from because of ovarian cancer. 2018, I came back into the OUH and started the Nursing Associate Apprenticeship. It's absolutely fantastic. You're never too old to learn anything. I'm 47 and I absolutely love it.
Thank you, and you'll see some of the stars from that film with Freya and Jess, who you'll hear from later. So there are currently more than 70 healthcare specific apprenticeships. As you can see here, it's just a quick snapshot of a selection ranging from a podiatrist to registered nurse, to midwife, to district nurse. So really a great variety of healthcare specific apprenticeships, and there's more and more coming on board all the time in order to support a career pathway. Thank you, Ellie. And this is an idea of some of the non-healthcare specific apprenticeships that are used in the NHS. And we all, I think, appreciate it's not just about doctors and nurses. We need a variety of members in the team to ensure that everything runs smoothly in terms of caring for the patient at the centre of everything that we do. So as you can see here, there's apprenticeships around senior leaders, managers, team leaders, around HR, IT, finance, and customer care, which are all really essential as well. So a great variety of the non-healthcare apprenticeships as well. Thank you, Ellie. And here with a quick snapshot again of the top 20 apprenticeships in 2018-19. And down the bottom there, you can see the most popular, such as the nursing associate, which is a relatively new role that's been introduced to bridge the gap between a healthcare support worker and a registered nurse. And this is a standard, a foundation degree that the individual will come out with after 2 years of studying, which we'll talk a little bit more about. So that's the most popular. And then behind that is business administration, and then a couple of more clinical roles behind that, a senior healthcare support worker and healthcare support worker level 2. So you can see working up through the list, the sort of typical numbers that we have. And I mean, even since 1819, we've had more and more standards developed. So it's a really fast moving arena of apprenticeships. So it's just to give you an idea of typical numbers. And apprenticeships do provide a really robust career pathway, as I mentioned earlier. So this is a typical one, and information for these can be found on the HASO website, which is the link down the bottom of that slide, for Skills for Health, a specific example around pathways. So going into entry level, Level 2 is equivalent to 5 GCSEs, a Level 2 apprenticeship, and you can normally undertake this within 12 to 18 months. And a typical entry level point is the healthcare support worker, an excellent role to start your career in care. And you can start there, or you can start at the one above, a Level 3 apprenticeship, the senior healthcare support worker, which is absolutely fine. And some people decide to stay within those roles and they develop within those roles. But if you wanted to, you can then move up to that career pathway to that nursing associate, which I mentioned, which sits around a Level 5 standard. As I mentioned, that's a foundation degree level. Normally you study at university for 2 years. And again, you can stay at that level and develop in your role. But if you wanted to, you can then build on that, take your qualification with you and apply for a registered nurse degree apprenticeship, which is Level 6 at degree level. So there's room and a pathway if you aspire to go higher, or there's also sort of in-house training programs if you want to remain as you are and keep that apprenticeship level. So that's an idea about the levels and a typical pathway. Thank you, Ellie. And another pathway is really exciting, is around the ambulance service. So you can go in as an entry Level 3 as an ambulance support worker. And then if you wanted to, you can then build up, once you are successful at those different levels, all the way up to potentially a paramedic degree at Level 6. And the beauty of these, of course, is they're generally funded by your employer because they have a levy that can pay the providers for these. Thank you, Ellie. And this is similar one around IT. So you could go in at a Level 2 entry level, perhaps in IT support, and then can move up through a technician role and maybe to a professional. But there's all sorts of different digital apprenticeships around cyber security and more of the support for individuals working in the NHS. Thank you. So what is the NHS looking for when recruiting apprentices? And it'd be good to have a think about and just, you know, take a few seconds just to reflect, because it's not always the easy option. So thank you, Ellie. We'll go on to the next slide. So we've put together a few top tips really, and hopefully you'll also hear from our apprentices about some top tips for anyone considering an apprenticeship. So it's definitely not someone not looking for an easy option, because you will be expected to achieve academically and at work, managing your time really well, prioritising, maybe you do have some assignments due for your apprenticeship and you're working in the day as well. So there will be certain expectations of you from your manager and your team. And sometimes, you know, you might find a bit of a shock coming from school into sort of employment, full-time employment, working 37.5 hours a week, and then try and fit in your study. So it's, you know, obviously people in your workplace will help you adjust and support you, and people on your course, sort of your lecturers and tutors, will also help, but it's certainly not the easy option. And we in the NHS, you know, looking at application forms, we will want to see people who can be self-motivated, can do the independent study and use their own initiative, and really be prepared to put what they learn into practice. And that, I think, really makes it real, and you can put it into context of what you're learning and actually putting it into your day job to help you. And it starts to make sense as well, and hopefully you'd start to enjoy your role. Enthusiasm, we'd certainly want to see an enthusiastic person, and maybe we can see they've done some research, and it's not just about the academic ability either. And it definite interest in the role, and interest in the area they want to work in. So whether it's a more clinical, working with patients, or with science and the laboratories, it does help if you've maybe had some work experience, we've done a little bit of research, and you show you're keen and enthusiastic to learn. And NHS values, I'm sure you've heard the NHS talk about these before, but they're really important to us. And if you do any sort of application form or supporting statement or interview, we would want to see the demonstration of some of those NHS values, such as teamwork, respect and dignity, compassion, showing how you're kind. And very often, with roles in the NHS, we can teach you certain things that you need to know, but it's about having those values as a person that are really important to us, and you've got that sensitivity and skill, and you work well with people. So got a couple of links there, so do have a look on the NHS Constitution and search up values, and there's all sorts of short film clips and ideas and examples about the NHS values. Thanks, Ellie.
That's great. We can share those links as well, so don't worry, everyone.
So a bit about the application process. I mean, where do you even start to look for jobs and for apprenticeships? So the NHS Jobs website is a really good resource, and you might not always think about going there, but don't be put off. It looks fast. Use the key search terms, look at the organisation or the area, the geographical areas. So where you're looking, whether it's Oxford or Reading, Berkshire. Also look at your local trust website as well, and have a look for that. Also, I mean, I've been talking about NHS apprenticeships here. We also have good relationships with social care as well. So they also run apprenticeships as well in a variety of areas. So look at the local council website. Also, vacancies may appear in for apprenticeships on the Gov website, NHS Jobs we've mentioned, but there's not always fixed deadlines for apprenticeships. They can start maybe twice, 3 times in a year, normally around September, sometimes around January and April. So always keep an eye out. You can set up alerts on NHS Job websites. On NHS Jobs website, there's also hints and tips online about doing a good supporting statement as well, good application. And also within the Thames Valley, we've got our local enterprise partners. So Oxfordshire LEP, Oxfordshire Apprenticeships are a good resource, as is Berkshire Opportunities as well. So there's lots of websites to look at there.
That's great. And we've just been asked in the chat box a couple of times around these links, but don't worry, we will share them with you. We've got a wealth of links now, so don't worry. Parsa and Dawn, great question.
Thank you. And again, some more free resources and information. So Health Careers is a really excellent, I mean, it talks about over 350 different careers in the NHS. So even if it's perhaps not an apprenticeship, but you're thinking about a career in the NHS, it doesn't have to be clinical, it could be anything within the NHS. There's a wealth of information on the Health Careers website, lots of short film clips, case studies. So that's really good. Step into the NHS is also a really good resource. Amazing Apprenticeships, an apprenticeship guide. You can also register on Find an Apprenticeship. Maybe you're looking for something in your local area. And also just wanted to let you know about some exciting things coming up. So the National Apprenticeship Show, 10th of February, What Career Live and World Skills UK Spotlight Talk. So again, I'm sure you could Google those and find out how to register and how to get involved. Thanks, Ellie. And again, I think if you can, it's about putting yourself out there, having a look at Twitter, Facebook, maybe having a profile on LinkedIn, trying to follow certain people that regularly mention apprenticeships, maybe your local trust or organisation near to you. So do have a look. NHS career professionals, I notice, are very active on Twitter, and they regularly put on information and job opportunities there. And there's also another ability to sign up for alerts through the vacancy snapshot, which is being developed for the NHS apprenticeship schemes. And just some key messages really, and I suppose building a little bit on that myth busting and those polls that we did at the beginning about degree apprenticeships. They are equivalent to undergraduate degrees elsewhere. They are awarded by universities and set an equivalent standard to those gaining the full-time academic route. So you're just doing it in a different way. And delivery can be perhaps one day a week attending university. That might be face-to-face or online. And then the rest of the time you might be using that learning in your workplace. So just a different mode of delivery. Apprenticeships can absolutely be an alternative to university or college. And they can really appeal to people who may not have seen that really as a viable option for them. And again, with no training fees or those student loans to pay back. And they do offer a great start to a career. It's not just a job. And as we saw earlier in the film, 90% of apprentices in England remain in employment after qualifying, and 71% stay with that same employer. And apprenticeships can provide a career pathway. They can start at level 2 and work towards the profession of their choice. So it's a great opportunity. Thank you.
Great, thanks so much, Claire. That's given us such a good idea, and we've seen so many kind of questions come in already that I know that we're going to cover some good ground today. So thank you so much for that. And we're lucky enough, like Claire mentioned, to be joined today by some of the stars from that little film that we just watched, who are going to give us a bit of an idea in terms of what they've been up to and who they are and what kind of the route they took in. I'm going to do just in terms of alphabetical order of introduction. So Abby, do you mind kind of giving us a bit of an idea, say introducing yourself and what you do really?
Yeah, of course. So I'm Abby. I'm a nurse cadet, which is a level 3 apprenticeship. So I'm working as a band 2 healthcare support worker. And I'm working with Oxford Health's Children's Community Nursing team. And it's been a really good team to start off my career in, because there's so many different aspects that different parts of the team I've been able to work with and get loads of experience. And so parts of the things I've been doing is I've spent some time in the office with admin, and there's all the children's nurses are always in and out of the office, and they've always been there for me to ask questions to. They've helped me learn how to accept referrals to the team from the hospitals and send referrals to other services for the children on our caseload, which has been really great. And I've spent time with the respite team, which I've been able to build relationships with patients and families, which has been absolutely lovely. I've been able to learn loads about the patient's conditions and how they're dealing with them, and all about the treatments and stuff that they've received.
Wow.
It's really nice to sort of get to spend some time with them and actually sort of get to know them, and for them to get to know you.
Definitely. What an amazing kind of experience this year as well. I've got so many questions for you, but I just want to make sure we do a bit quick intro. So thanks, Abby. Freya, what about you? You're right, give us an introduction.
So my name's Freya. I am a level 3 apprentice and I work at the John Radcliffe Hospital. I currently work in maternity in somewhere called fetal and maternal medicine. So I started my level 2 there in 2019, and then I progressed onwards in September 2020 to my level 3. I work with an amazing team who's so supportive of me, and I would say the main aspects I've learned about in my apprenticeship is I've had lots of confidence. I wasn't very confident beforehand, I was a bit shy, but now I've gained lots more confidence, valuable workplace skills and lots of enrichment opportunities, and I've learned to embrace lots of challenges.
That sounds amazing. And Jess, just over to you then, and then I'll go back and ask some specific questions.
Yeah, so my name's Jess. I'm also a level 3 apprentice, business apprentice, and I work in legal services. So my main role and my job is to disclose medical evidence, which is factual witness statements or medical records to the police, coroner's court and county council. So for the police, that's to assist in the prosecution of alleged offenders. For the coroner's court, it's so they can determine how somebody died. And for the county council, it's to sort of assist with children who might be experiencing abuse or neglect, so they can be either permanently or temporarily removed from their homes. It's a really interesting job role that I didn't know existed beforehand. So I've been really, really grateful to have that opportunity.
Amazing. And I'm going to start off with a question for you. And so you just mentioned around you had no idea that existed. How did you get into what you're doing? How did that journey happen for you?
So originally I applied for my apprenticeship. I kind of stumbled upon it when I was actually looking for a full-time job after I did my A-levels. I wasn't sure what I wanted to do. I didn't really want a full-time job. I didn't want to go to uni either. It wasn't the right decision for me. So I just stumbled upon the apprenticeship and applied for that. And legal services kind of just came out of the blue, and it was a great role, something that I was really interested in. So yeah, that's how it kind of stumbled about by accident, kind of.
Yeah, amazing. And did you say you were looking for a full-time role, but did you think apprenticeship when you were having that conversation, or was in your mind, or was it just
no, I wasn't really informed about apprenticeships at school. Like Claire said, I kind of thought they were just for like engineering, mechanics, things a bit more vocational. I didn't realise that you could do an apprenticeship in like admin roles like legal services. So yeah, that's something completely new to me. Yeah.
Amazing. And it makes you think, doesn't it, in terms of like keeping your options open and things like that. But it kind of ties in as well to Freya, what you were saying around confidence building and things. What was that journey like for you? So when you were at school, how did you decide to go down the route you've gone down?
So for me, obviously I left school at 16. I had absolutely no idea what I wanted to do. I knew I didn't want to do A-levels, and I did actually have the grades to do A-levels, and I felt a bit pushed to do A-levels, but then I actually decided I'd look into apprenticeships. I did lots of research, and when I went to one of the recruitment events, I actually saw OUH, and I looked and I instantly knew that that's something I wanted to do. And the surprising thing was actually I wasn't doing anything business related at school. I just thought it would be an amazing start for me, something new, and yeah, I really enjoyed it. So I started when I was 16 at the John Radcliffe for OUH, and I loved my team. They were amazing, really supportive. I learned so many new things, and I was 100% supported all throughout the way. And I think I've been given so many opportunities that I just know I wouldn't have had at school. So I just think an apprenticeship was the most amazing choice I made.
Amazing. And you can see the confidence as well from the fact, being on these things like this, which is great. And Abby, I guess maybe a slightly different route than if you're going down a more clinical side of things. How did you decide, and what were your influences, I guess, to your decision?
So I've always known that I wanted to go into healthcare, but I just sort of wasn't sure what aspect of it and how on earth to get there. So luckily, so I was really lucky to get some work experience at Whitney Community Hospital in year 10, which is where I got to spend time shadowing some nurses, some physiotherapists, some doctors, and worked with some administration staff. And they were all amazing. They were all brilliant at what they did, but it was the nurses that really, really stood out to me, and you could tell they made such a difference to the patients, made such a difference to their stay in hospital, and made it so much more pleasant for them. And that's sort of when I decided, okay, I think nursing's sort of what I want to do. And I've always really liked the idea of apprenticeships. They sounded so good, but I just thought the only route into nursing would be through A-levels and university. So yeah, obviously I was absolutely delighted when my school advertised the nurse cadets, to know that, at 16 that I can have such like hands-on experience with patients, and like Freya said, so many opportunities. There's no way I would have had in A-levels, and to have had this much clinical experience in the few months that I've been with the children's nursing team is just absolutely amazing.
Oh, that's so great. And it's so nice, the story in terms of thinking about these opportunities that have come up for you, and hearing about them through school and those different influences. I know that we have lots of questions coming up in the chat box and the Q&A, so don't worry, I will get to them, I promise. But we're just going to go through a couple more questions in terms of covering off top line. And one of them I wanted to mention was, you three have clearly been very successful, and you're successful in the fact that you're kind of sat on the other side of this panel. Jess, what kind of advice would you give to someone on the other side of the screen, maybe, who's thinking, oh, I wish I'd love to be in their position in a few years' time?
I would say don't be afraid to explore your options. I mean, you've got so many options like university and, you know, jobs, apprenticeships, and there's so many different apprenticeships, clinical and non-clinical. Like I said, I never knew that legal services was an option. And I know so many apprentices who are doing different roles. So yeah, there's so many different options that you can look into. And if you don't like one area, you can always change. They're not completely permanent. Like you can do 12 months apprenticeship for level 2, you've got level 3, which is 18 months. They're not set in stone, and you can always then take your skills and transfer them into different areas. So yeah, I'd explore all the different options. Don't be tied down to anything.
Absolutely, and do your research. That's great, great advice. And Abby, I guess as an extension of that, some people might think, oh, I don't know, would it be too challenging going into nursing? I mean, I'm a bit apprehensive in that sense. What would you say to them? Is it, yeah, what would your reality be?
I'd say it is, especially from leaving school only a year ago, especially when it was cut so short because of COVID. I think it is a massive jump into sort of like an adult world. But I think there's lots of benefits of that, but there's also a lot of responsibility. So I think sort of be prepared for that. But then again, the apprenticeship has helped me build so many transferable skills. My time management's improved massively. I've learned, my confidence has also built up loads. You know, if you asked me to do something like this a year ago, there's no way I'd be sat here talking to you, but here I am. And yeah, even things like answering the phone in the office a couple of months ago, I'd always be so anxious to do it, but now I just pick it up with no thought.
Yeah, you'd absolutely not tell as well. So it's definitely good evidence of that. No, great advice. And, you know, things are challenging, and it's good to be realistic and say, you know, it has been a kind of shock to the system, and that's actually a good thing for young people to prepare themselves for. Freya, in terms of kind of short term as well with the application and how you found that process, was there anything that you would give in terms of tips on that side? I know maybe it was thinking back to that.
So I obviously found my apprenticeship through going to careers events. So how I actually did apply, and some really good tips I have in terms of applying would be to make sure you research an organisation, and like Claire said, look at the values. That's really important, especially for OUH, making sure that you know all the values, and also reading the job description as well, because a lot of the time in interviews they do ask, what do you think you'll be doing? And it's really good to just go through, make sure you know what you're doing. But also I would say another tip would be, I very luckily got to see where I was going to work before I actually worked there. So I asked if I could be shown around, just to give me a kind of idea where I'd be working, who I'd be with. And that was really good as well to kind of prepare myself. But those are some kind of tips I would give for people applying at OUH.
Yeah, absolutely. That's great tips. And also the fact you're on this session today, like talking about those things and learning from people who've been through, I just, even though you might not physically be able to go into in the same way Freya just mentioned, you can also be in virtual settings like this where you're asking questions to people, and you can talk about that in interviews and things like that. I can see lots of questions coming in, so rather than me stealing all of the time for my questions, I'm going to move on to some in the Q&A box. And we've actually had a few in the chat box, which I might get through quickly first. What did Jessica say her role title was? It sounds really interesting, from Amy Kate. What's your role title, Jess?
The actual title is a police and inquest coordinator in legal services. But yes, it does entail like child protection as well, but that's just the general title, yeah.
Great. Yes, it's a very good title to have as well. I quite fancy that. So we've had another question in which Freya touched on now, so I'm going to throw this question back to you, Freya. What type of skills do employers want in an apprentice? So you mentioned things you've done, but yeah, what kind of skills do you think they're looking for?
I would say definitely things like past experience. It's not necessary, but volunteering looks really good. And I think also skills like being able to work in a team, being able to use initiative, and not everyone will have those skills. And obviously when you do an apprenticeship, you will learn those skills. But I think the basic kind of skills to work in a team, like using initiative, but also mainly just kind of good teamwork skills. But that's what I would say the main skills you would need.
Great, and absolutely we can help with those types of things in terms of CVs and applications. So do hang on to the end and I'll give you that survey to help support you in the next step. So, but great question, Hassan. So just looking at some of those other questions in the Q&A box now. So do I need to take biology A-level for most of the apprenticeships? I think that's a really interesting one because I think all of you, did anyone do biology A-level? No, we got no's all round. So to whoever asked that question, you don't need to do biology A-level. There's absolutely no problem if you don't have that. And then another really interesting one. So do I need to know the NHS in and out, for example, the history of the NHS to apply to an apprenticeship role or a university application? I can see some nods in disagreement. What about Jess? Was that part of kind of the process for you?
Sorry, what was that? I didn't hear that.
Do you need to know NHS in and out, for example, the history of the NHS in order to apply?
Oh, no, you don't need to know the history of the NHS. Know a little bit about the NHS and sort of what they do generally, but no, you don't need to know the history of the NHS. If you do, it's great. But no, I don't think that's essential.
No, that I thought that might be the case, but good question. This is maybe one for Claire around the different roles which are available, but can I study in a university and be an apprentice at the same time? So degree level apprenticeships.
Due to the funding, apprenticeships are funding and they're very strict around their funding. So you could only be on one programme at a time. So you could perhaps undertake an apprenticeship after your university course, but you couldn't be funded for both. No, unfortunately.
That's fine. Thanks, Claire. And so many good questions coming in. I'm always like overwhelmed by the amount of strong questions. And so a question from Parsa: are there any short-term apprenticeships that I can apply to so I can get an insight to the NHS when applying to do medicine? So is there anything kind of a short-term, I guess, work experience? There's a lot available, isn't there, Claire?
There is, absolutely. So work experience, obviously a really tricky time at the moment, but hopefully work experience will get back face-to-face, possibly from Easter, possibly September of this year. There is a lot of virtual work experience on at the moment, all different aspects around nursing and medicine. So there's more and more virtual work experience being developed. To be an apprenticeship, it has to be at least 12 months in length. So perhaps if you wanted to plan for a gap year, say, perhaps, I don't know what you're currently doing, say after your A-levels, and you wanted a gap year, you could potentially do an apprenticeship, being a healthcare support worker perhaps, and gain sort of the care certificate with that. So you've come out with quite a bit at the end of your apprenticeship and worked within the healthcare team and really gained a good insight into what the NHS is like and provided patient care. You could learn sort of phlebotomy skills and taking blood along the way as well. So that would probably be a very useful apprenticeship if you wanted to gain an insight into the NHS. But also you gain a lot of skills in business administration. You're still dealing with patients, working in busy acute teams in challenging times. So there's a variety of, but those shorter ones are sort of 12 to 18 months in length. So it's still quite a commitment, really.
Yeah, absolutely. There's plenty of kind of resources out there in terms of experience and things like this, which you could help apply for your medicine, on that journey. So no need to do an apprenticeship on the way, if there's other things out there as well. Jodie's really keen, Jess, in terms of understanding what A-levels and things. Did you need any particular A-levels to go down the route you've gone down?
No, you didn't even need to do A-levels. You can go straight in from GCSEs, but for reference, I did health and social care, psychology and sociology A-levels, but I don't think they particularly influenced. I think you can still do it without it. You don't need those A-levels particularly, but yeah, it kind of links in with the role I do, so it's a good start.
That's great. And we've got plenty of budding students who are looking to do similar things, it looked from the questions. So an interesting one, Abby, I'm going to ask you. Will we go into hospital with COVID going on? So how's that situation been for you from a nursing side? And I think it might vary, mightn't it?
Yeah, so I think it varies throughout the nurse cadet. So because I'm in a community role, I'm not based in a hospital. What we do as a team is go out into children's homes and provide their care in their house, so it's a bit more of a familiar environment. Some of the nurse cadets have are working in community hospitals and some mental health inpatient wards. Although I think they're not, we're not forced to do anything, especially because we're so young and we've just started. They wouldn't force us to do anything, but a lot of the nurse cadets have chosen that they do feel comfortable with it because we're given so much PPE, we're given so much protection. I'm doing lateral flow testing twice a week for an extra bit of reassurance. And a lot of the nurse cadets have already received their vaccine, which is really good. So they're doing a lot to take care of us, and they wouldn't force us to do anything, but there is that option at the moment.
That's amazing. Yeah, that's really good to hear and interesting, because I think that might vary. I mean, Freya, have you been in hospital or anything from?
Yeah, so obviously COVID started when I was doing my level 2. And I worked throughout the whole of COVID in the hospital. I think it varies in department whether you can work from home or can't. But with my role, I wouldn't be able to work from home just with how closely I work with healthcare professionals and things. So I have just been working in hospital, and lots of other people have been working in hospital, you know, with social distancing, wearing masks, lots of things are in place to keep you safe. But from my personal experience, I've just been working as normal.
Great. Well, it's good to that's good to hear in terms of how that's continued for both of you. We've had a couple of questions come in of similar like, which is around the presentation and around those links. Absolutely, Anna, we'll get them sent. We'll send everything for you through to you in terms of resources, so don't worry about that. One really good question I thought from Hasnain, which is, what sort of things would affect your chance of getting an apprenticeship, and how can you avoid that? Or what can you do to improve your chances of getting an apprenticeship? So I know we've covered kind of top tips and things like that, but I don't know, Claire, is there anything else that people can be doing to improve their applications, do you think?
I think by reading, I think by people recognising the transferable skills they're bringing with them. So if they've got a part-time job, waitress, working in a restaurant, doing some volunteer work, supporting their neighbours, maybe they've done some shopping for a neighbour or a friend. I think it's really trying to sell themselves and think about all the skills that they've got. I think that sometimes comes across, that people perhaps don't talk about all those skills and qualities that they've got. Doing the research, talking to people in the healthcare sort of environment, and trying to get involved in any activities if they can, if it's about volunteering. And I think it just shows those people have gone sort of the extra mile. Again, it links back to the values that I know Apprentices mentioned. So that is really key, and to be able to talk about themselves as well. And if people struggle to think about what they can offer, is maybe talking to a friend or family about thinking about some of their skills and qualities, I think would be really key.
Yeah, absolutely. I think that's good in terms of even the questions that are coming through today, you know, are really impressive in terms of if you ask these types of questions in your interviews and things like that, I think people would really be impressed. And one of them, which I'm going to call out because I think it's a really great question, Hodan's asked, and Abby, I'm going to ask you this question. What do you expect from, what's expected from team members in a particular position? So yeah, what do people expect from you as a team member, as an apprentice?
So in my role, I'm sort of expected to carry out. So if it depends where I am really. So if I'm in admin, I'm not expected to do anything by myself. I'm often asked, you know, do I feel comfortable doing something, and I'm offered support to do it. And a lot of the nurses, they'll do things with me to get me to understand and slowly build up my confidence to do things by myself, which is really good. And out on visits, so at the moment I'm doing quite a lot of shadowing, just sort of while I learn, but I've also been offered a lot of training opportunities. Again, nothing that I would have ever been able to do in A-level, so it's really good to learn, but I'm never forced to do things that I'm not comfortable with. I'm always offered that support to learn, but not forced to do anything that I'm not comfortable with.
Yeah, that's a really great answer, thank you. And Freya, I wonder, how does that vary, I guess? What's the expectation from a team member side of things?
I would say definitely when you're an apprentice, even though you have the title of an apprentice, definitely in my team, I am treated like a normal team member. And so all of those values that would a normal permanent member of staff are still expected of me. So like being respectful of my colleagues, communicating well to my colleagues, you know, showing compassion, and just kind of showing a good kind of teamwork skill, I guess. But I think definitely when you are working with a team, you are expected to work as a member of the team, even if you are an apprentice.
That's great. Yeah, some of those key skills which kind of tie into that question earlier around the key skills. So yeah, just great question. Ask that on the interview, Hodan, and they'll be very impressed. And so I'm going to just ask a few kind of role questions, Claire, that have come up, which to see if we do know if there are any roles in particular areas. So around social work, Beatrice is keen to do an apprenticeship in social work. What kind of things are out there, and where maybe could we signpost towards?
Well, I do know there are degrees in social work for apprenticeships. So I believe it's looking at sort of websites. I know Oxford Brookes do. I possibly think BNU, Bucks New University do. So I think it's having a look at the university websites, and sometimes it's perhaps speaking to the admissions team there and say that you're interested in an apprenticeship, say in social work, and they might be able to put you in touch with particular local employers who are looking to support individuals do that. Sometimes it's a tricky situation because sometimes you actually have to get a job in an organisation first in order to then be supported to be an apprentice, perhaps a degree apprentice. So it really does vary. So that is slightly more tricky. You know, like nursing, for example, not all employers will offer a direct route into a degree straight away. So I think if you're interested in social work, it's having a look on Skills for Care website and trying to look at local opportunities, looking on the local council website for opportunities about apprenticeships, speaking to the education team in those organisations and asking their advice. And sometimes they can either signpost you or put you in touch with organisations that are recruiting. So I think you've got a couple of different ways. Go straight to the education, the training provider like the university, and also look at local employers as well. And I guess for social care, it's looking at the local council and also Skills for Care. And they sort of showcase all the different roles within social care as well.
Amazing, yeah, and we can make sure that we mention those in the follow-up, like you said, with the link. So don't worry, we can signpost you there. And we've had another couple of questions around midwifery and pediatric nursing. So with those different routes, is there anything else to bear in mind just at this stage?
Sure. So for apprenticeships, midwifery is still relatively quite new. I believe the standard was signed off sort of the end of last year. And unfortunately, not all employers perhaps will currently offer midwifery apprenticeship. I know some universities are running the programs. So sometimes it's again going to looking at all the universities that are offering it and seeing which employers are perhaps engaged with that. I think in time, there might be some funding to help employers offer this more. Because I think what some employers may find that if they are releasing someone on a degree program, they need to have a certain amount of protected learning. So it can be quite costly for employers. So it's just trying to, for employers, they need that support as well. So some may offer it straight away and some may offer it slightly further down the line. It's like nursing. Some will offer it direct route onto it. Some you will have to be working in the organisation first. So some students have found they've got a job as a healthcare support worker and then they apply for the degree in their organisation. Or some in maternity, they might have to get a job as a maternity support worker first and then apply. But again, it's worth talking to the employer itself, your local employer, because there might be all sorts of different opportunities. So I mentioned the nursing associate role earlier. That is being introduced into midwifery. There are also roles called assistant practitioners that are sometimes found in maternity, and you can then top up to a degree. So it's definitely worth speaking to learning and development or education teams in your local trusts and organisations to see what they can offer.
That's great. And also there have been quite a few kind of queries about really specific roles, about going down the paramedic apprenticeship route. So I'm just really impressed that those people that are writing in have an idea of where they want, and we can definitely help with that signposting situation. So if you have a gauge on what you want to do, we can very much help in that area. So Amina, you just asked around the pediatric apprenticeships. Is that a case? Do they?
Yes, again, so children's nursing, there are more apprenticeships becoming available now. I know one particular training provider is offering that to local trusts and employers. So, and at the end of the day, it's really up to that employer and what they decide to offer and what their workforce need is. So they will see how many midwives they need, how many nurses, how many mental health and children's nurses they need, and then they will ordinarily go out to recruitment and try and draw in young and local people into their programs. So you might find there's not so many children's nurses around, but more adult nurses. So it really is up to that local employer to offer those really specific programs.
And just one quick question which has come up a couple of times, which is for all the specific kind of requirements for each different apprenticeship. So that will be on each job description, won't it, in terms of the application process. So around Chloe and Amy had that same question of the driving license for the paramedic role. If that is required, I presume that will be on the job description, wouldn't it, Claire?
Yes, it should be. And I would definitely signpost individuals to South Central Ambulance Service website. They've got some great resources about working for them and just the different ways in. So we went through those career pathways, starting as an emergency care assistant and being able to work their way up. And they can guide and advise on, I think it's the C1 driving license. So, and it's always worth speaking to someone in SCAS, people from their education team to talk about that, and they regularly run recruitment events. And I think they've got one coming up, so they can talk about all the different opportunities, and it's opportunities that we might not always think of, about a call handler, emergency care assistant, and the paramedic. So there's a variety of levels if people want to be involved but not necessarily on the roads driving.
Yeah, absolutely. And that ties in exactly, Dilpreet, to your question around the qualifications. They will be specific to the different roles across the board. So do keep an eye on those. And if any kind of appeal to you, then it's just a case of going through and making sure that you have those qualifications needed. We have got quite a few questions left in the Q&A, so don't worry, we will kind of continue and go through those. But what I am going to do is pop in the chat box, just that survey link. So for when people do have the opportunity, or if they happen, if they need it in the meantime, then do make sure that you fill out that survey in order for us to kind of give you that really close feedback and support following the session today. So we've had a good question, which is around the different skills we've spoken about today. And Freya, I know I keep asking you around the same question, so sorry about that. But I'm confident that you have a good answer for this one. So once the students have understood the skills they need to demonstrate, how would one demonstrate that in an interview? So how could you demonstrate teamwork, or those different ones you mentioned earlier?
So when I applied, I read the kind of job description, and when I did apply, I basically kind of highlighted what they wanted in the role, and then I thought back to a time where I might have done that or demonstrated that kind of skill. And that could, like Claire said, that could be like doing volunteer work, helping a neighbour. It could be anything at all, that as long as it kind of relates to that skill. I basically wrote that down, and if you do highlight it or just kind of so you can understand and kind of relate it to something that's personal to you. So that's how I would say you can, because there's lots of things that you might not think about as something you've demonstrated as a skill, but I think definitely if you kind of think about it, highlight it and think, when have I done this? Because there's lots of things that you have done, you just don't think about it. So that would be my kind of tips for someone who was in an interview and not quite sure how they would demonstrate a skill.
Amazing. Yeah, no, brilliant example, and one for students to bear in mind as they are kind of going through that process. Jess, one for you. So Charlotte's asked, what's work-study balance like? Is it difficult to find time to study and do a bit of both? How have you found that?
So we have like allocated study time. So I have 4 hours a week of allocated study time. So I do mine on Thursday and Friday mornings, but I can change that with my employer. It's quite flexible. And then you've got a training day once a month in the level 3 apprenticeship anyway. You have it once a month where you just go to a training room and you just go through basically like in school, just a day of like a lesson. And balancing that I think is okay. It's been okay for me. I think 4 hours a week is enough time to fit in all the extra study you need to do, just working through your coursework, answering the questions that you've done in your training sessions. I think is okay. It's manageable. Yeah, it's okay.
That's good. Yeah, no, and it's good that you can kind of be a bit flexible in terms of that timing with the employer and make that work for you. So that's brilliant. And another question is coming from Ellie, which I'm going to ask to Abby. So do you have to take A-levels to apply for an apprenticeship? Is that the case, or how did that go for you?
Absolutely not. So I applied for 2 sixth forms to do my A-levels. But after a lot of thinking about it, I knew I've had 5 years of school, and I just wanted something new that was just going to challenge me and just be a bit different, and sort of it really feels like I'm just sort of a step closer than I would have been to where I want to go in the future and what I want to do for my career. But absolutely not, you don't need to do A-levels.
That's great. Yeah, no, really reassuring. And I've seen that question come up a couple of times. So that's really great. And just on that point, we've had another question, which is around you saying about your future and your career. Do you know if you can transfer across departments or wards, or is that something, which is of interest when you're thinking about your progression?
Yeah, absolutely. I'm not, and nothing you do is sort of stuck in your role. So at the moment, I'm with the community children's nursing team. But that doesn't mean at all that in the future I couldn't work in adults, I couldn't train in mental health. And you can always, if you start doing something and you realise it's not for you, you can always retrain and find other options.
Yeah, that's great. So I always think that people say that your career isn't necessarily always a straight line, is that it's always kind of wiggling and seeing what you like and enjoy. So that's really great to hear. So another few questions have come in. So Lauren's asked, do you have to do loads of night shifts, or does it differ depending on the job? So Freya, how's that experience been for you? Have you shifted?
So with like apprenticeships, normally the hours are really good. So I normally do 9-5 every day, and then like Jess said, have the 4 hours study time where I choose. So sometimes I finish at 12:30 and then take my lunch as well, and then I have a half day to do all my study time together. But they never, for admin anyway, in my role, they don't expect you to do night shifts or anything. I think it depends in what department you're in. You might want to do night shifts, but because mine's an outpatient department, I only have to do 9-5. You can also do 8-4 or 10-6. But I prefer at the moment, with the weather and how dark it is, I prefer 9-5 because then I can get into work easily.
Great. Yeah, no, definitely I'd be the same. I'm an early bird, and that's good to know there's flexibility. Does that change for your role, Abby, being patient focused?
Yeah, so sort of, because every day I'm working with different teams, the hours can change, but I don't work night shifts because the team generally runs from sort of 8 to 8, and we have the nurses sort of change shifts halfway through. But I generally do from 8 till 4, or if I'm with respite, it's from 9 to 5.
Great. Yeah, no, that's good to hear, like the variety and with the changing teams and things like that. So we've had an question around the kind of qualification side of it. So Jennifer's asked Claire, will an apprenticeship in the NHS be recognised overseas? So say, for example, you wanted to go and then work overseas, is that something that would be recognised?
Tricky question. I
Yeah.
mean, normally they are, you know, for people in England. So I would imagine that you would have your qualification. It is nationally recognised, but I imagine you would have to show that potential employer what you've covered. So they may want to look at some equivalency or map it over to perhaps a similar qualification to what may exist abroad. So I would obviously keep all your evidence, whatever you've done, to be able to demonstrate that. Absolutely. But it shows that, you know, in England you've worked at a national, you know, agreed level. So I would imagine there'd be some recognition and acknowledgement of it. But always keep everything that you've done to show and demonstrate your new employer.
Absolutely, yeah, and good question in terms of, it's definitely something we can look at, look up for you as well in terms of what that is like. So Taksha has asked a question: how much work experience do you need to have a successful application, and what do you GCSE grades you need? So I guess the qualifications do vary role to role, but Jess, around work experience, how much did you feel like you needed for that application, and how much did it add to that process for you?
I didn't really have too much work experience. I had a couple of days I actually worked with CAMS, and it was only 2 days work experience, and that's pretty much all the work experience I had. It was enough sort of interesting sort of things to grasp from that, like a transfer and extrapolate to my interview and the application process. So I think as long as you have maybe some, it doesn't matter what area it's in, as long as you can then transfer those skills and show your values, that's the most important thing.
Yeah, definitely. That seems to kind of be resonating through, which is making sure you do your research and that you understand the values in your application. But obviously work experience is great, but I'm sure as well employers will understand that it's been a difficult year in terms of work experience, and we really do encourage people to talk about events like this. You know, that's showing willing, and work experience has been challenging. So Masuma has asked the golden question: when will real work experience be back on? And I ultimately, unless anyone says otherwise, but I think we're kind of unsure at the moment, aren't we? And these types of things are kind of the equivalent for learning those things you need to know.
Absolutely, and we hope we might be able to get back to some normality, but that probably won't be to the autumn now, September time. And even then we might rely more on these virtual events, or do a bit of a mixture of virtual and a little bit of face-to-face, but it all depends on the areas and how the hospitals will be. But I suppose it's not always thinking about those busy hospitals. There's a variety of things you can do, from talking to people who are doing the job, and just having short visits. So it really does depend on what you want to do, really.
Yeah, and it ties quite nicely into a question that Zoe just asked, which is, would it be difficult to apply if you have zero work experience? I don't know if anyone has a particular to jump in there, but yeah, Abby, go for it.
I think more valuable than work experience is having just any kind of experiences you can talk about that show transferable skills and knowledge and ability to sort of work while studying, or just time management and things, like I said, transferable skills. I think it's just about having any sort of kind of volunteering, anything like that.
Yeah, definitely, and understanding that process. So someone asked about the application process previously, and I think actually at the moment people understand that work experience is very difficult, and so really doing your research, coming to events like this and filling yourself up in terms of what the process will be like seems to be the answers coming through today in terms of what to do. Someone's asked, are there any remote or virtual opportunities? And Claire, you had a list of those upcoming events, didn't you? So maybe we can share those as a follow-up there.
Yes, absolutely. Berkshire Healthcare are running a couple of events, I think one of which is tomorrow, and one is around I think the 17th, all based around the psychological professions. So if there's any A-level students or any students interested in psychology, so that's something we could certainly share. And that for me would, you know, be considered as work experience. You're actually finding out about those job roles and gaining a good insight into what it's really like.
Yeah, absolutely. And so keep your eyes peeled for things like that, which you can kind of join like today. We've also been asked a couple of times around applications and when they'll be open, but I think it really does vary from role to role and from kind of employer to employer. But is there any, so really what we should do maybe after today is, like I say, the importance is filling out that survey that I keep sharing in the chat box, just to make sure that we know what you're interested in and how we can help you. And then we can really start kind of signposting you to the different employers and what roles might be available. But Claire, in her kind of presentation earlier, did really signpost around places you can look for jobs. So NHS Jobs was an example. So really we'll share that content and make sure that you know the kind of places to look, if that's helpful.
And very often you can be on people's mailing lists, and I would say be determined and resilient. If that's what you want to do, maybe put in a regular call to the education team, try and build up a relationship. You know, obviously if you're polite and you can find out about the opportunities coming up. And I think colleagues love that. If they see that you're keen and motivated and really enthusiastic, they want to help you. And very often, you know, we might be able to, you know, when work experience then comes back online, it's trying to set you up with a visit or anything like that. So it's trying to build up those relationships as well, I would say. Don't give up.
Definitely, and keeping your options open. And it ties into a nicely phrased question, which I wanted to ask you, Claire, which someone has asked in the Q&A box: what jobs in the NHS can you not get? And I think that summarises quite nicely the range of opportunities there are, isn't there?
Yeah, there are so many different jobs, and you know, I mentioned earlier, there's 350 different careers. I think there's an apprenticeship attached to more or less every one. And when you think about the whole of healthcare, particularly, and the busy hospitals that they run, from such a range, from the garden, the catering, you know, you don't even have to be near a patient necessarily to be involved in the NHS and undertake an apprenticeship. So there's so many different roles and opportunities.
Yeah, absolutely. And Hamad's asked in the chat box, Jess, I don't know if you have access to the chat box in terms of what your role is. And I know we've already asked you that question, so I don't want to repeat it. But if you do, and don't mind popping in the chat box what your role is, and I think someone's very keen to follow your route there. And if you can't, don't worry, we'll follow up with that, Hamad. But another question that's come in, I'm conscious of time, so in terms of these last few questions, I guess, then how will, I know that we've asked the question around GCSEs or A-levels. We can definitely know that you don't have to have done A-levels to go into an apprenticeship, but how old do you have to be to do an apprenticeship and becoming an emergency care worker or that side of things? And do we know around the age limit for that? I know it's quite a specific one, and don't worry if not.
That's a tricky one. I know in my experience from clinical apprenticeships, we can take individuals from the age of 16, but for thinking about the emergency care assistants, so working with the ambulance service, that may be 18, so I would probably refer that on to South Central Ambulance Station and inquire with them. It could well be 18, so I'd need to sort of check up on that. And it all depends on, I think, the level of supervision and support that people are able to have, certainly, yes.
Amazing. And some other kind of specific roles have been asked, which we can definitely follow up on if is apprenticeships in kind of dentistry was one question. Do we know if there are any in dentistry?
There are in dentistry. I'm trying to remember. It's not an actual dentist themselves, but there's apprenticeships. Some are available and some are being developed as we speak. So I believe around dental hygienist, dental nursing, we know is quite an established one. And again, another good resource is the HASO website, which I've mentioned, HASO. You can just type that in, and then you can put in the search terms of the thing that you're interested in, such as dentistry, and that will show you all the different apprenticeships available at all the different levels. So we mentioned the level 2 was sort of GCSE level, level 6 was degree level, and you can see all the apprenticeships available ready to go now. And then it normally then signposts you if you want further information, or you can see the actual apprenticeship standard, what you will be expected to achieve. So I know there are ones around dentistry. I know not the full dentist role itself, but who knows, that could well be developed for the future. There's definitely support for doctors developed with a physician associate. That is available, and they're working on another medical support individual to support doctors. So there's more and more coming all the time, but there's definitely ones around dentistry and working within the dentistry team. And also I just wanted to mention, Ellie, I did have a look on NHS Jobs website yesterday just to see if there are any live vacancies, and if anyone's interested in applying for any apprenticeship vacancies, they are there. So there's particularly ones around business administration for Berkshire Healthcare. In Oxford Health, they're advertising for an adult student nurse, level 6. Oxford University are advertising for their pharmacy apprentices, a level 2. And in Milton Keynes, they're advertising for medical records. So even if people didn't want to apply now, they could go into the job descriptions and have a look at typical sort of entry criteria, qualifications that they're asking for, if that's what they're interested in. And in the near future, Health Education England will be advertising for 2 business administration apprentices undertaking a level 3 apprenticeship. So do keep an eye out and set up those alerts if you're particularly interested in any of those jobs I mentioned. I just thought it was worth mentioning that there are ones that they're all the time, really, so it's worth just keeping an eye out.
Yeah, absolutely. And I think there have been so many good questions come in that are quite specific to different roles, that what we'll do is we'll take them away and then make sure to share with people those kind of follow-ups from those particular questions. I've just shared again the kind of survey in the chat box. So I really do encourage you, if you are interested in a role in the NHS, to fill that out and just and we can get in touch and we can really help support you through the process. Conscious of a couple of questions kind of being similar and coming throughout, and like themes coming through these last questions, and some of them being more specific. I think what probably would be best just now, we've been asked a lot around challenges and a lot around the best things of your role. Freya, Abby and Jess, I'm going to ask you maybe to summarise what the biggest challenges have been, what your most kind of rewarding and positive elements of what you've done. So a bit of both, just to give the real aspect of what these young people are kind of thinking about their futures. And then that could be a nice way to kind of tie up and make sure that we do get all of those questions answered specifically as follow-ups, but just to kind of tie up the panel and as a summary. So Freya, am I right to ask you first, because you're first on my screen?
Yep. So I would say the most challenging thing throughout my apprenticeship was actually when throughout my level 2, when coronavirus started. I found that so challenging because lots of members of my team were off ill. We were severely understaffed for quite a long time, and it gave me lots of insight on how the department works and what kind of responsibilities I'd have to temporarily take on when, say, if one of my colleagues I was working with wasn't in. So that was really challenging, because there were some days I was coordinating the whole department and I was thinking, I'm only 16 and I'm doing all this. But I think it was so rewarding at the end of it when we got all the staff back, and I actually knew that I could get through that, and I had the experience, and I know in the future I'd be able to do it again. And I think that's like the rawness of working in a real workplace, but I think it's definitely so rewarding, especially for me.
Amazing, that's so impressive, and what a good experience, and yeah, nice to hear both sides of it in terms of how important it is. Abby, over to you. What about you?
Yeah, so I think the biggest challenge was sort of at the start getting used to, especially during COVID, a lot of things sort of being cancelled last minute, me being like needed elsewhere, especially not being able to drive yet, only being 16. It was quite difficult sort of trying to be in places, get places quickly. But it didn't take me long to sort of understand, okay, I've got to be quite flexible with this role and sort of expect things to change, expect things to be quite last minute. But I do enjoy it because it keeps me thinking and working hard. And I think the most rewarding part of my role is seeing how much the patients and their families appreciate our service, and because it saves them from having to go into hospital for things like for their like IV antibiotics and things. Usually they just have to go in every day, and especially with a young child, it's really unsettling anyway, especially being in a strange environment. So it's really nice to see how much they appreciate being able to stay at home and having people there to care for them.
Yeah, that's amazing, and different examples as well to Freya, and hearing about those different side things. So thank you so much, Abby. And Jess, over to you.
I'd probably say my biggest challenge was sort of getting used to all the new systems they use within the NHS. There's loads of different sort of IT systems and online things that you have to get used to using, which was quite different for me and was something to get used to. But the biggest reward probably is just being responsible for things and having your team look at you like a part of their team, and you are the one who has your own sort of tasks and processes that you're responsible for, and that then you can ask for help, but people sort of rely on you to do that, and you're not sort of being sort of cooed over and things like that.
That's amazing. And I think one thing personally as well, and from a Pathway CTM side, is like, it's so brilliant to have 3 people on the panel that have had such different experiences of different roles and different kind of day-to-days. And also, even from your answers just then, often we have panels with people that have done the same role in the same company, and it's kind of repetitive, whereas in this instance it's so different. You're doing such different things and they sound so rewarding in different ways. And not only is it impressive that the students are on at this time, but we're also so appreciative that on a Monday, after all of the challenging work that you're doing, which you've spoken about today, we really appreciate your time. And I know our students will benefit a lot from kind of hearing those. So thank you so much for kind of contributing and giving us your time. I know that we've still got a little bit of time, so there are students asking a few questions, but Claire, I just wanted to make sure that we kind of wrapped up the panel, and I see you've put a few links in there, so I didn't know if there was anything else from your side.
Yeah, I did put in the chat box the link for the event tomorrow to register for. So that's sort of an NHS virtual careers evening. So there will be a little bit about apprenticeships in there, absolutely. I just wanted to pick up on a question, if I could, Ellie, that I saw that I thought was quite a pertinent question, that if someone said they joined an apprenticeship and it got too hard, and if they had to leave, would they have to pay back? And I haven't seen that in my experience, that anyone has had to pay back any of the fees. And what we'd like to think of is there'd be lots of discussion with tutors that if you were finding it hard or you were struggling, you might be offered perhaps a lower level, either a step down, or what some people have done, they've left their apprenticeship, but they've remained in a very similar role within the organisation. So I'd hate someone to think they'd have to leave if things weren't working out. There is lots of discussion and hopefully support from education teams around that. We don't want anyone to be set up to fail, or we want to ensure that there's the right programme for you. And that's why there's that guidance and advice at the beginning to get the individual on the right level as well, and the right programme. So I just wanted to reassure people about that, really. But no, I think it's been an amazing event and some really great questions, and very specific, as you say. So I really would like to spend a bit of time perhaps to be able to send out some questions and answers for individuals at a later date.
And we can get some examples of those different roles potentially for students I know that have been asking around quite specific roles and what those next steps are. That we can put together a bit of a visual for students that have been on the line around those different routes and those different roles, just to kind of help support there. So Pathway CTM from our side, we can kind of do that for you and make sure to help with that clarity side of things.
And also, Ellie, I saw a question about males. I know we've got 3 young ladies here, but there are absolutely males in the NHS undertaking apprenticeships, and I just wanted to reassure people. It is a very diverse working environment as well. So, we're used to working with people with a variety of backgrounds, and yeah, absolutely.
Yeah, that's so important. And I think also a great question to ask, like this is a good forum to practice those kind of questions you will be asking in interviews. And if I was sat and someone asked me that based on kind of the demographic of the person interviewing them. I think, Hamad, well done for asking the question. What a brilliant question. I've definitely asked that when I've sat in interviews before, so well done. And AIM, yeah, and we've had quite a few great questions, so don't worry, we will come back to you. But I just think based on that, keep researching. We'll follow up with every single one of you that attended today. Don't worry, you will get a follow-up from today, and you will get the recording of today's session. And we'll also follow up with these kind of questions that we've been asked and make a bit of a frequently asked questions for you to make sure that we can help you on your journey to wherever that might be. And I'm excited by the fact that we've got lots of different journeys, and from things that people are interested in today, from IT to being a doctor, you know, a lot of the different people on the line wanting different things. So that's great to see. And for us at Pathway CTM, it's our first event in National Apprenticeship Week, and I've absolutely loved it. Been amazed by the amount of questions and the attendees. So well done to everyone. Claire, thank you so much for kind of all of your information and running the session. We really appreciate it. Don't worry, I'm going to just post the survey. I know I put it in again. Do put in a thank you and how well you found, how you found the session. I'm going to pop that in the chat box now and hang around for a couple of minutes, because I know the survey might take a minute or so. But yeah, thank you so much and have a lovely evening, everyone.
Thank you.